And I would get all these text messages. I'm like, this is such an interesting phenomenon. We're training at one of the best programs, and the general psychiatrists that are graduating from these programs don't feel well equipped when they see pregnant patients. I remember seeing some of the most well-read, most esteemed professors kind of put up their hands when they saw someone that was pregnant. And so I think this is simply, it's not part of the general curriculum enough. This includes for psychiatry residents, but I would also say all the way back to medical school, I would say that this is also something where OBGYNs don't necessarily get the most up-to-date training either. And it's really a space where we have to invest more time and energy in education, because mental health issues are the number 1 complication of childbirth. And yet we're training OBGYN so well in treating gestational hypertension or diabetes during pregnancy, and yet this is kind of a blind spot.
Yeah, and I think that is so important to emphasize, that it is like the number 1 complication. Everybody talks about hypertension, gestational diabetes, preeclampsia, all of those conditions, and it's really important to talk about them, but it's just as important to talk about the mental health aspect of it.
Absolutely, right? Not nearly as many people are impacted by gestational diabetes, but we know, right? Every pregnant person will tell you, I had to take that really gross drink. That is right in every pregnancy, and people who get prenatal care, they have that experience. But if you ask people if they've been screened for mental health issues during pregnancy, you are going to get a very diverse set of answers.